if that works. We want to work the remote. Pushing to the right, we'll go forward, and we'll go backwards. And then you have a laser pointer in the middle there if you want to use it. Okay. Cool. All right, let me get into position here.
All right, so my name is Adrian. My name is Carlos.
I'm Anthony.
And I'm Karina.
And we are presenting on restless leg syndrome.
Okay, so a restless legs syndrome, plural, because when I was searching it up, I kept getting confused between singular and plural. It was introduced around like 1945, 1940s by a Swedish neurologist named Ekbom, which is also why sometimes you hear it referred to as WED, the Willis-Ekbom disease. It's a common movement disorder where the people who experience it have this constant urge to move. It's usually accompanied with restlessness, jerkiness, and even pain, and it only is relieved when the person begins to move. And it commonly becomes even more severe during the evening or the night. So that's when people experience the most uncomfortable feeling. So how does it feel? You can keep on the same side. A while back, I was having issues with my transmission in my car, and I went to my mechanic, and I didn't know how to explain to him what the noise my car was making. So I just told him that my car was going like, and whenever I put my car in reverse, it would jerk, right? So that's kind of what it's like to describe RLS to your doctor. People have a very hard time putting into words what it is that they're internally feeling into their legs. So it's commonly described as like a creepy, crawly, jerking motion feeling inside their legs. Some people describe it as worms moving around, soda bubbles in their veins, the heebie-jeebies, electric currents, and my favorite, Elvis legs. So who can get RLS? It's important to know that anyone in any age group can get restless leg syndrome. However, it is more common in adults and especially in middle-aged women. 10% of adults are diagnosed with RLS annually. And if you are under 50, the onset is a little bit more gradual. It's not as severe. If you're over 50, it's typically sudden and accompanied with pain. Some patients will experience symptoms for a period of time and then it'll go away for many years. So how do you know if you have restless leg syndrome? The diagnosis is basically based off of medical history and physical examination. And although it's really easy to diagnose, it often goes underdiagnosed, either because people are not aware of the symptoms, they don't think it's severe enough, or they're too embarrassed to go to the doctor and tell them that they're having these issues and they're like experiencing sleep deprivation. So don't freak out just because you're an anxious person and like you're like bouncing your leg up and down. That doesn't mean that you necessarily have restless leg syndrome. There's actually a 4-point criteria that we're gonna go over that kind of goes over the characteristics of having it. But keep in mind, if you are experiencing the symptoms, it's so important for you to speak up and talk to your doctor. Okay, so the criteria.
Yeah, so I'll get to the criteria of how doctors diagnose people with RLS. So first question the doctors might ask are, do you have an urge of moving your legs by feeling these different sensations? And we'll get to the symptoms in a minute. The other question is, does it worsen or does it get better at night? You know, I mean, that's one of them. Or during periods of inactivity at rest, are you feeling those sensations? Or do you get temporary relief when you're doing your exercises? Okay, so once those questions are answered, then they can diagnose if you have RLS. So we'll show a video.
This is Stan. It's about a 5-minute video. We're only gonna watch like 30 seconds, but pay close attention to the way that his legs jerk, they jitter, they move, he's restless, and eventually he has to get up. Oh, it didn't start it up.
Oh. So the individual is pretty much trying to get his rest, and due to feeling those sensations, he voluntarily can move it, but you can also get involuntary, and we'll get to the research on why it could be either or. Okay, so some of the symptoms they might feel, and like I mentioned, it could be either a neurological disorder. When it comes back to the research, it would say the basal ganglia is the primary source of where the disorder comes from, and sleep disorder from the patient's not being able to get enough sleep because of these sensations. So paresthesia is pretty much like sharp pins and needles. They might be feeling that. They might have some tightness in their usually lower extremities, their calves. They might be feeling a sense of pulling. They're also, depending on the weather, they might feel certain sensations. Like, so warm sensation because it's really hot, it can get real bad, cold sensation, or they can actually feel those sensations, whether it's hot or not. But, and they might get numbness, aching pain, throbbing pain. So in most cases, RLS is idiopathic, meaning they don't know where this came about. But there are certain studies, like a specific gene variant, which they have seen different chromosomes that might have that gene, the RLS. And like she mentioned, 10% of people before 40, that's something that they can look into. And then the last two, I did research, the low levels of iron come back to this protein, ferritin, which stores iron. And when they took a blood sample to see the ferritins, usually most of them had low levels of that. So, yeah. So the basal ganglia, I read that the dopamine, it can't be, the receptors don't take in the dopamine, so usually we need dopamine for our smooth coordinated movements. But because, and I think in that video, I think it might be an issue with the basal ganglia where maybe he's not moving with intention, but involuntary he was due to the basal ganglia disruption.
All right, so I'll talk about the treatments. So for mild restless leg syndrome, studies show that lifestyle changes are possibly the only necessary treatment to cure this, or not to cure because restless leg syndrome is actually for life. So some of this involves decreasing consumption of alcohol, tobacco, and caffeine. Decreasing the consumption of caffeine before sleep is actually encouraged, and this goes to having a proper sleep cycle, so having good sleep hygiene. This means having your 6 to 8 hours of sleep, having a good bedtime routine, and that actually decreases some of the symptoms a bit. When the symptoms are active, taking a warm bath, it does help, so that should be part of a nighttime routine as well. And as well as using a heat pad or an ice pack could actually help reduce some of those symptoms. So for rehabilitation approaches, massage therapy is very common. Stretching and movement of the leg while the symptoms are active help, and as well as aerobic exercises, keeping it light to moderate intensity, such as walking and using like a stationary bike type of treadmill type. And then also there are medical devices that help, such as a foot wrap that actually helps compress the foot and it puts pressure on the muscles to relax them. And then for the chronic RLS symptoms, medication is often prescribed, but that should also go with doing the lifestyle changes. It's controlled by treating it could also be controlled by treating a different medical condition, such as how Adrian said, the iron deficiency. So iron supplements or iron replacement therapy could help with that for individuals who their cause is due to iron deficiency. One of the most popular and first prescribed medication is anti-seizure medication, which right here is gabapentin. This is for the more moderate to severe cases. And we also have dopaminergic therapies. This helps with people who don't have dopamine in the brain, and we will actually get into more of that later. And also opioids and benzodiazepines. That is actually the last option of treatment for individuals who all the other treatments have failed for them. These are a little bit dangerous just because of how addictive they are, but opioids and benzodiazepines are actually one of the most effective ways of treating RLS.
So yeah, current state of RLS. So although there has been a lot of research that has gone into RLS, it's still a poorly understood condition. And this is especially true in the medical community as a whole. Now you might be asking yourself, like, how is that so? Well, part of the reason is, well, it has a lot of similarities to other conditions like Parkinson's. but also as of right now, it does not appear in the curriculum at medical schools or in the postgraduate training. So basically, a lot of our MDs are not getting the proper education on how to treat RLS. Okay, that's why diagnosing and treatment will depend on the country you live in and the experience and education during their training. Now, most doctors are aware of the disorder and they know how to treat it, but know how to diagnose it. But the problem lies on treating the disease. You know, a lot of the doctors are likely to look for guidance in research that is out of date. So the key is updating the research. Okay, new science and breakthroughs. So the data shows that the treatment with dopamine agonists for RLS has adverse effects on the long run. So dopamine agonists are now considered the go-to treatment for RLS. And this is mostly because it's very effective when treating the symptoms of RLS. But the problem lies in the long run. Okay, so drugs like ropinirole, pramipexole, and rotigotine, they're all of type of drug which you call dopamine agonists. So dopamine agonists are basically a broad category of drugs that mimic the action of dopamine in the body. So since the approval by the FDA, there has been significant evidence that a person can go through something called augmentation, which means that you get progressively worsening of symptoms during long term. So basically, the drugs don't work like they're supposed to. Now, they seem to work very good in the short term. You know, they help you with the symptoms, cut them off completely. But in the long run, they basically wreak havoc in your body. But yet, the drugs are being used as of today. Also, FDA has currently approved a new form of gabapentin. So gabapentin is also highly effective and it's safer. But now there's a new form called enacarbin, which shows promise. It doesn't have a lot of the side effects that gabapentin has, like drowsiness, mood swings. And also, studies conclude that RLS symptoms could be significantly reduced through exercise. So a more recent study of last year, it concluded that, the trial was conducted between 12 weeks, and one group was prescribed a conditioning program of aerobics and lower body resistance training 3 times per week, while others were sedentary. By the 6th week, the exercise group scored significantly lower on the severity of their symptoms. So it was concluded that a good exercise program consisted of resistance aerobics were effective on improving symptoms. So this might be due to the fact that exercise contributes to good sleep, better quality of life, and overall health. So after going through all of this, what should be focused on for future development? Well, as we can see, the standard for treating RLS are dopaminergic drugs. Due to the assumed nature of RLS, it has made the pharmaceutical industry to mostly focus on developing the said type of drugs. The problem here is that they almost completely exclude all other research going to other agents. So instead of putting money into these drugs, we could instead focus on alternatives to treating our RLS. Now, also, focusing on good treatment design. One of the greatest problems, nearly all RLS treatment trials have been faulty design issues. So like I said before, doctors don't really know how to treat RLS properly. So if we update procedures and awareness and institute them around the world, we won't have these problems and we will get better results.
Okay, so since we are kind of like the group before Halloween and we talked about a creepy crawly disease, we just want to ask you guys 3 quick little questions and give you guys an opportunity to earn some candy. Because I see a whole bunch of you guys nodding off. Rude. Okay, so question number 1. Let's say you think you might be experiencing restless leg syndrome, right? What's an appropriate way to bring it up to your doctor and discuss it with him? Anyone? Your hands first.
Sleep. Like you're getting sleep deprivation cycles.
Yeah.
And
Think of
then-
like the criteria. You can't sleep.
And then having lack of focus or lack of control. I don't know what that last. I don't remember it, but it was like something about not having the control of like movement.
Mm-hmm.
And I don't
Like,
know.
do you mean like needing to move?
Yeah, like
Like
the
not having the control whether not to move?
inhibition of movement,
Mhm.
like having that. And then like the last was taking off like environment like factors, others like lifestyle factors,
Okay.
food, caffeine, and all that. That was I don't remember.
How do you feel about that?
I'm just
I
going with this.
guess. I'm just kidding.
Thank you.
Next question.
I got a question.
You guys got a question for me?
My guys are shy.
Okay, so what types of medication are the last option for individuals who do not respond to any other treatment?
Ooh, her hand went up first.
Benzos and opioids.
Yeah.
Milky Way's okay? Sorry. Do you have a question?
No, anyone have a question?
Are you guys there?
I had a question. In the beginning, you mentioned that restless leg syndrome is more prevalent at night or late in the day. Is there a reasoning for that you found?
You know what? During the research, I did read that people found that maintaining their minds occupied, whether it was like a deep conversation or even computer games, kind of lessened the severity of their symptoms. So I'm assuming at night when they're resting and their nervous system isn't in so much control of what they're doing in their everyday, that's when the urge kind of kicks in. Do you guys have anything else to add? I hope that answered your question. I think it just has to do with like the inactivity of like the brain. I'll be back.
So you said that typically it's only around the age of 50 that you start seeing this disorder. What's like the earliest age that you would think comes in?
You actually do see it in children as well. Like if you look it up on YouTube, there's like countless videos of like kids that can't sleep through their like their daycare, except that they don't know what the movement is, so they don't move their legs. They bring in their arms, like they'll hit their head to try to get it to stop. Does anyone have like is it 5% of kids?
I'm not too sure, but the studies show like women are more prevalent.
Mhm.
But if you are having symptoms before 40, then they can track it back to a gene, and that's when they can see that that's where that's coming from.
Is there like types of therapy, like physical therapy or occupational therapy that you can do like instead of taking medications or something like that?
What I pretty much read from the research was just like doing a lot of aerobic exercises. Massage therapy was one of the big ones that I read a lot about too. They didn't really talk about any like muscular like strengthening, but those are the 2 main ones. Just pretty much doing aerobic exercises, walking, making sure the leg is moving, as well as the massage therapy, so that way you could get in.
And the thing about exercise is as well that people that have RLS, they are discouraged from exercising to exhaustion or to the point where they might feel soreness, because that will increase the severity of their symptoms at night or in the evening.
So we see exercise as a treatment. Did you find anything that said that sedentary individuals are more prone to this? Does it occur more for sedentary individuals?
Correct.
Yeah. So I was reading that people with neuropathy, people who have diabetes, people who have kidney failure, they're all prone to getting RLS because of like kidney failure, for example. They're kind of anemic, so low levels of iron is found, and then they have those symptoms arising from all that.
I think.
Yeah, I read like autosomal dominant. Just, yeah, that. It passes down.
Yeah.
So kind of going off, like how early you can catch it, are people born with it? Can you be born with it, or is it something that's only developed?
Quite honestly, I don't feel like there's enough research done to be able to tell. Like they're just barely being able to track it back to a gene. So I don't think the research is. Did anyone else did that come up during treatments or something? Like,
No, yeah, I didn't see anything like that, where like if you're born with it or if it just happens like at a certain age, I'm not sure.
yeah. But that's something that we can focus on in the future, right? Yeah.
So you said that there are treatments. Is the treatment gonna completely treat this situation, or is it gonna just slow the progression of the disease?
It doesn't even slow the progression, it just pretty much relieves symptoms at this point. There's no progression, and there's no cure for it. It's pretty much all the treatments that I have here is just treating the symptoms at the time, just like the benzos and the opioids. You take those at nighttime, so that way that with the benzos, you could at least sleep through the symptoms, but there you can't cure it or anything.
Like there's cases where people want to go on long flights and they can't sit there for that length of time because their legs they start feeling the jitters, and then they have to take like
the benzos.
these drugs that help them out. Yeah, just to control the symptoms.
You mentioned something in the beginning. Is there such thing as restless leg syndrome, like singular? So it's only legs.
It's only, at least in every like research article that I was able to look into, it had plural. Like initially in our presentation we had restless leg, but the more research we were going through, we realized that it's restless legs. I'm assuming because it can happen in both. It can happen just like Stan. When we watched Stan in the video, both of his legs were jerking at the same time.
I did read some that go to the hands, but most of them were in the legs.
I think it begins in the legs, and they use their arms as part of their movement in order to bring down the symptom. Like they feel it, and so they kind of like try to stimulate another part of the body to get rid of that sensation. I guess we're good. Yeah.
What are the like the age differences between more gender differences or like cultural and racial differences?
There wasn't much science on the cultural, but when it comes to gender, I'm assuming this just based off of what we were reading. I feel like women probably experience it more, as pregnant women also experience restless leg syndrome. So it might have to do with like the biomechanical imbalances in their body, just like not having enough iron.
Yeah, because of the menstruation, they lose a lot of blood.
So yeah.
Low levels of iron. Iron.
I hope that helped. Yeah.
Anything else?
No.
All right, well,